Chapter 9, let's talk about the endocrine system. The endocrine system and the nervous system do work closely together. Hormones can help balance our sympathetic and parasympathetic nervous systems. The endocrine glands are also known as ductless glands compared to exocrines such as sweat glands, digestive, etc. The tissues that The tissue that is influenced by a specific hormone is called a target tissue, and then the tissues have receptors. Okay, I promise not to read this whole chapter to you. Let's see. Hormones produce extremely small amounts and they're highly potent. This is why you never ever want to take, unless you're prescribed, of course, by a doctor and you're monitored, you don't want to take any type of hormones without somebody know, especially steroids. We talked about that in an earlier video. Um, you really do need to do hormone therapy or hormone replacement with a physician or provider's assistance and advice. Okay, the endocrine glands, they are throughout the body. You can see here where they're located and their names: the pineal, hypothalamus, pituitary, thyroid, parathyroids, adrenals, pancreatic, ovaries, and testes. Focus on words. Are you in good humor? You can read that on your own. Endocrine glands and their hormones. So this shows you where the glands are. This is the name of the gland, the hormone that it does, and the principal function. So you can review that. Again, you don't have to be an expert. I just want you to know where to find this information if you were to need to look it up. Growth hormone is clinical use for growing. You can read that at your leisure. So just starting off with the pituitary gland, this information is going to dig deeper, even in the thyroid and the parathyroids. So please review that, read that. This is all the anatomy. The adrenals, which are located on top of the kidneys, very important functions there. The pancreas. Happy to report. This has nothing to do with medical terminology, but I just can't help but say it. Sometimes when I'm reading these, the pancreatic cancer 5 years ago was not survivable. And here in the past year, year and a half, there have been some reports and some case studies proving some therapies are working for pancreatic cancer. So, yay! And once you understand more what the pancreas does and its hormone um, requirements, etc., that's a huge win in the battle against cancers. Okay, other endocrine tissues. There's that pineal gland that we were talking about. By the way, let me back up. I just can't help it. Little nugget of knowledge here. The pineal gland, anybody who gets motion sick in cars or different areas, methods of transportation, I should say, it's usually because of the pineal gland. So you can look up how to prevent that, do things to prevent that motion sickness. Okay, roots pertaining to the endocrine system. So here are your root words that you would want to know for this chapter. Their meaning is listed out here in the definitions. More exercises that you can do to practice this information. Clinical aspects of the endocrine system. And again, we're starting with the pituitary. So here are disorders, if you will, of what, things that could go wrong. So I shouldn't say disorders. Hang on, let me see if there's a section. No, I guess I am right. These are the disorders listed. Um, yes, it is adenoma, acromegaly, panhypopituitarism, diabetes insipidus, diabetes mellitus. That's all controlled by the pituitary gland, guys. And then our thyroid does a lot for us. If you have any type of thyroid abnormalities, these different conditions can occur. Adrenals, Addison's disease. One of our presidents had, is it JFK? One of our presidents had Addison disease, and it got that disease a lot of attention while he was our president. And of course, after Cushing syndrome, all these that are listed have to do with hormones, which is pretty wild how important these glands and the endocrine system can be. The pancreas and diabetes, you can read all about that. Ketoacidosis, popular topic. Diabetes, metabolic syndrome. So metabolic syndrome, this is where, like I mentioned with chapter set, well, I've mentioned a couple times, I think that was course, you can reverse this. This is not too late. This is kind of like your warning sign before you get to diabetes. You can change this going outside, walking 10, 15, 20 minutes a day, eating whole foods, stop eating the processed foods, stop eating fast food, or at least cut back, drinking your water and just water, not the processed things you can put in water. You could really reverse this just by taking excellent care of yourself, and not something wild. You don't have to do, hardcore boot camp exercises, just simply walking. And you can still have some processed food, maybe once a week, but not 3 times a day. Replace that with the whole foods. Diagnosing these type of endocrine issues. Hang on a second, guys. I got a cough. Okay, sorry about that. Diagnosing these issues can typically be done with blood tests, certain presentations that patients walk into the doctor's office for. Treatments vary between people, but lots of treatments are coming out, even new treatments, for weight loss and um, insulin, not replacements, but alternatives, I guess. Terminology, acromegaly. This is the overgrowth of bone and soft tissue. Addison's disease. It's the deficiency of the adrenocortical hormones. Adenoma would be a neoplasm or cancer of a gland. Adult hypothyroidism. This one's very common. Um, you have to take the levothyroxine, the thyroid replacement hormone to treat these. Cushing's disease, Cushing syndrome, diabetes insipidus, diabetes mellitus, phalamus, giantism. There was I'm not going to know his name, but there was a wrestler, a American wrestler who had giantism. More terminology. Okay, I had to mute you again. I'm not even sure if you could tell that, but I was coughing. Hashimoto's disease, ketosis, pituitary apoplexy, seasonal affective disorder, SAD. So this is a acronym that I know, or abbreviation I know that is approved. This is something a lot of us suffer from, and it's usually winter time, just when it's so cold outside you can't go out like you used to, play in the dirt, work on in your yard, walk outdoors, listening to nature. When it's cold outside and in the wintertime, people tend to get influenced by those environmental factors. So thank goodness the seasons change. More terminology. Oh, look, here's a clinical perspective section on that seasonal affective disorder, terminology and abbreviations. Again, for this course, I just want you to know where to look for these. HbA1c, this is very common when you're getting your hemoglobin or blood work done, checked. T3, T4, T7, so these are all thyroid abbreviations when it comes to getting your blood work checked. TSH is another thyroid. I recognize these. IGT, impaired glucose tolerance. See, I don't recognize that one. That's why I'm not really requiring you all to learn these or memorize these. And that's it. That is it for chapter 9. So please, when you review the anatomy, when you review the disorders, please, don't hesitate to ask me any questions and complete the exercises at your leisure if you want to. The answers are in the back of the book.